Have you ever wondered if your favorite cereals and snacks qualify as ultra-processed? You may soon have that answer as the FDA is set to define what qualifies as ultra-processed food for the first time in history. The FDA told the New York Times of the anticipated change Tuesday. Currently, nutritionists broadly define ultra-processed foods as products created in an industrialized process. Basically, not anything you could make with the help of a stove, air fryer, or pressure cooker or other methods in your home. These products can also include ingredients like artificial sweeteners, dyes, high fructose corn syrup, chemical preservatives, and hydrogenated oils, ingredients that aren't likely in your cabinets individually. The FDA's definition could set the stage for transforming what kids eat in schools, what former and current military service members are served at VA hospitals and military installations, as well as what's for dinner in prisons. The change could also modify U.S. dietary guidelines, impacting what is covered by SNAP benefits. The Times reports the FDA and USDA will be seeking public comment before deciding on a definition. The agencies did not give an exact timetable for the rollout. The commissioner of the FDA tells the Times the definition may have companies labeling products as non-ultra processed, similar to how they use reduced sugar, low sugar, and no sugar added labels to draw in customers. He says the goal is not to outlaw processed foods, rather to inform consumers and encourages companies to compete based on health. The push comes as a number of states look to regulate ultra-processed foods, including Texas, West Virginia, and Arizona, who have targeted dyes and ultra-processed products through legislation. Doctors also warn eating ultra-processed foods is linked to increased risk of cancer, heart disease, stroke, diabetes, and stomach problems. The FDA's deputy commissioner says the agency will look into the use of emulsifiers, artificial dyes, and preservatives as a way to define what is ultra-processed. Nutritionists predict the move will be met with resistance from companies who use ultra-processing to produce cheap foods in a short amount of time in large quantities. They also warn against a broad definition that demonizes foods that aren't harmful to people, while also noting too narrow of a focus risks excluding potentially harmful ingredients. Instead, they say the definition must be refined and well crafted to ensure it encompasses the health risks associated with consuming ultra-processed foods. If done right, health academics say the new definition could be used in new warning labels or to determine which products may continue to be marketed to kids. For more on this story, download the Straight Arrow News app or visit san.com. For Straight Arrow News, I'm Kaylee Carey.